डॉक्टर श्रावणी, आर यू
Yes,
देयर?
yes, ma'am. Yes, ma'am,
क्या
I'm there.
करेंगे? शुरू करेंगे?
Yeah. We'll start now.
Yeah.
Everyone has entered. Okay. So, hello everyone. Myself, Dr. Shravani Ghag from Asha Homeopathic Academy. I welcome you all for our today's session. This is our second session on cancer webinar series. We will start with our brief introduction with this video. These are the videos like sessions and organizations which we have been built up. These are the competitions. And these are homeopathic courses. So far, we have done NEEV, Clinical Diaries of Homeopath, Digital Cleaning Setup Program, and a therapeutic clinical course for homeopaths. If you want to participate, then you can find this on our website. Those were the workshops. These are the testimonials by our participants of our course. We started Homeopathic Junction page on Instagram. Here you will get all of the updates related to jobs, events, quizzes, books, and all of the courses. Anything related to homeopathy, you can share with us on this page. For this particular cancer webinar series, we have been collaborating with Vitality Homeopathy Clinic, which is by Dr. Hafiza Malik. She is at Surat. We also have free lectures which are available on our YouTube channel, like the mineral series, plant series, and other animal series. You can see those on our channel. These are the speakers of our cancer webinar series. And the next speaker would be Dr. Shruti Shaha on 10th of March, Friday at 3 p.m. Now I welcome our today's speaker, Dr. Jyothi Udupi ma'am. Dr. Jyothi Udupi ma'am is from Chennai. She has completed her BHMS from Government Homeopathic Medical College, Bangalore. She is presently doing FHPC from the Other Song Academy. She has been mentor in the Other Song Academy. She has given lectures on different platforms. Dr. Jyothi Udupi ma'am comes with several years of knowledge in classical, sensation, and personal evolution methods. She is known in the homeopathic circle for her clinical wealth of knowledge and willingness to share. She has a simple and intriguing way of teaching, which you all will enjoy today. Ma'am,
Yes,
I'll-
doctor. Yeah.
yes, ma'am. I'll give it to you so that I'll stop my screen sharing and allow it to you for your valuable knowledge to share it with us.
Yeah. Thank you, Dr. Shivani. Yeah. Good afternoon, all. Thank you very much, Dr. Hafiza and Dr. Yamini, and all of you for giving me this opportunity. Anything new really, excites people like us. Over this journey, not only I teach you something new, but I will also learn a lot of new things. So I always make an attempt to teach all of you something which you are aware, but with little, extra knowledge. So shall we start? Can you allow me to? Yeah. Yeah. Actually, I'm very thankful to Dr. Farooq J. Master, sir. There is one beautiful book called Healing Cancer, a homeopathic approach written by Dr. Farooq Master. There are 2 volumes. Like, I remember when we were doing courses in other song, whenever foreign patient is shown, we used to feel, out of place, because we see a lot of local patients, our own state language patient. So foreign patient used to be, somewhere we never used to connect. So we used to joke with the speaker, sir, please, sir or ma'am, please show me a Indian patient so that I can connect very fast. Although there are so many other authors, like last week, we came to know some new books about cancer. Somehow Dr. Farooq's master's book taught a lot of things to me when it comes to cancer. I'm very fortunate that in this season I'll be with Dr. Shruti Shah. I'm very, proud of Dr. Shruti's work. And her book on breast cancer is also a wonderful book. So possible you all should read that book. It is from Jain publication. But when it comes to breast cancer, any case, first book I refer is Dr. Shruti's book. So like that, our authors brings very, closer to the system to us. So some of the notes I have taken from this book. So if opportunity, if you get, please read this book. Because there is a lot of organon also in this book, which is very, very essential when you treat any homeopathy cases, especially pathological cases. We have forgotten that organon is essential in pathological cases. So it is better once all of you read this book. Does a big question now everybody is asking, not only homeopathic doctors, everywhere it is asked whether a person's mental, emotional nature really have any impact on getting cancer. So 100% it is true. Not only in the causation, but this also has a role in prevention and treatment of cancer cases. Cancer development and growth has multidimensional influences. So it makes sense that one's attitude or personality may play some role. No, this is all I am talking because maybe some people may say, why homeopathy in cancer cases? So it is a sort of justification how cancer comes and why homeopathy has a major role in playing in treating cancer cases. This makes sense that one's attitude or personality may play some vital role. This is called a cancer diathesis or cancer type in homeopathy. This is not told now. Even when you read older books, everywhere, even in organon books, even in philosophy, homeopathic philosophy books, we have read about cancer diathesis. The mind influences the body, and it is often found that prolonged psychological stresses affect the neuroendocrinal axis as well as the reticuloendothelial system, thereby weakening the host defenses and thus promote the onset of malignancy. Not only the malignancy, any autoimmune disease, any major pathological diseases, we have seen that it is all because of psychological stresses, which affects the neuroendocrinal axis. Health and disease are not static or mechanical conditions that can be turned on and off like a machine. They are dynamic and vitalistic and are associated with harmonious flow of life force from the depth of man to the peripheral surface of his being. When the emotional state resonates with the body's physiological actions, a state well-being and his health is generated. When the emotional state resonates with the body's physiological actions, a state of well-being and health is generated. If the emotional state is disturbed and out of balance, then this harmony is deranged. Physiological disharmony result and disease conditions are produced. Since a physiological disturbance can transform itself to the emotional plane as well, the necessity for perceiving the patient's total symptom picture becomes evident to the homeopathic prescriber. This is where totality of symptoms, irrespective of the pathology, homeopathic treatment plays a major role. So now we all know homeopathic medicines are 100% useful in the cancer cases. So old literatures, like take Clark, take Nash, take Allen, in all the books you have read that this is useful in this cancer. This remedy is useful in this cancer. Only the problem was we didn't know how to give, when to give, which one to give, which time. All those things now I am very thankful to doctors like Dr. Sarkar and Dr. Sujit and youngsters like Dr. Shruti, where they are helping us to know when to give which medicine. This is where we did a lot of mistakes in the past. So no doubt homeopathy works, but through my 26 years of homeopathic, practice journey, I have came across a lot of cancer cases. Some of the cases today we will be discussing. For example, in our literatures, what I was talking, synthesis repertory has 96 remedies for ailments due to grief. You all know, now a lot of scientists, lot of new researchers are talking about effect of grief, fear, everything on developing cancer. So we have around 96 remedies when you take in a synthesis remedy. If those are compared with General's Canceral Affection rubric, you see around 50 remedies covering both the rubrics, cancer and the ailment from grief. Even rubric like sympathetic, resentment with grief will cover a lot of cancer rubric. Fear, depression, anger, take any emotional reaction, you find cancer remedy in that rubric. So how we can use homeopathic medicines in cancer cases? Today I'll be discussing you in a two way. One is indirect cases, how homeopathic medicines helped. And there are some direct cases where I have used homeopathic medicines. Indirect cases, for example, this is first a breast cancer case. There is one patient who has, her mother has 6 sisters. And each, I think they have 8 first cousins, daughters, sisters, 8 cousins. So this patient 22 years back came to me. And she was very anxious. She was, showing a lot of restlessness. So I asked her, what is your problem? She said, ma'am, doctor, in my mother's family, all 6 sisters got cancer between 38 to 45 years. So I am worried because I am hitting 40 years now. I am worried that I may also get breast cancer. All of them have a history of cancer. And now my elder 2 cousins, aunt's daughters, are also diagnosed with the cancer. I don't want to have cancer. Do something. My mother always used to tell me homeopathy has a very good medicines. So we have been taking homeopathy here and there, but systematic homeopathic treatment I have never undergone. So I took all the history. As you all know, first I gave 1 dose of carcinosin 1M, which is, have a very strong fear of cancer and strong family history of cancer. So this is almost 22 years now. All other cousins got breast cancers between 38 to 40, 45, 46 years. And this patient of mine and her sister, younger sister, both are my patients. One is 60 years now, another is 56 years now. Or by, homeopathy's grace, they don't have any problem. Not that they never had any, psychological, emotional problem in their life. One of the patient had, a lot of anxiety because her husband was seeing somebody else, and they had a lot of, personal relationship problem. All those occasions, homeopathy really helped them and to come out of that grief, that sadness, then depression. But she was never. Recently, 6 months back, one of her other last cousin, who is 43 years old, was diagnosed with the breast cancer. And this lady again came running, and she was asking me, doctor, my last cousin also got. Only we both me and my sister who are under your care are still negative. So she was just joking, mera number kab aayega? So I told her, next time when if you talk about cancer, especially breast cancer, I'll throw you out of my clinic. So somewhere I think constitutional medicine, actually there was nothing like a cancer medicine, what you say this is all cancer medicine. There's nothing like that in homeopathy. She was, elder one was a elapse, constitutionally elapse. I give her whenever she has a crisis in her life. But till today, it's almost, she is 60 plus years. She has not got cancer. Even her sister is also divided because 20 years, whatever crisis comes in their life, they have been taking only homeopathic medicines. They're 2 constitutional medicines. So in this way also, I think we are very fortunate. We can help our patients by not getting. So her mother, who is, operated for breast cancer, always says, if I knew homeopathy prevents for not getting cancer, I could have taken for me also. But somewhere I read, and then I asked my daughters to get in touch with the homeopathic treatment. So I am proud, that we could help somebody. We don't know. 60, after 60, we don't know. If they are with the homeopathic constitutional treatment, I think they don't get in their lifetime any cancer. Like this, you also must be having a lot of such cases. There is one more case of an 8-year-old boy who was diagnosed with rectal polyp. And this rectal polyp is, precancerous condition. So the surgeon said it needs to be removed. So it is always, you are at risk. So they got it removed, and then somebody told about all this homeopathic treatment. They came to me. So I am treating that boy. Again, not, not treating for cancer. I am treating especially like constitutional this. Nowadays students have a lot of, stress, anxiety about exams, whatever, and a frequent cough, cold. His brother got his tonsils removed. So this boy, we helped through homeopathy to retain his tonsils and all. Now, every cancer hospital has a groups. So mother was telling me other day, there was another boy who got operated for polyp same time as my son. Now that boy has got a, polyp, which they say is turned into a cancer. So she was, was so thankful to homeopathy that son who is doing 12th now is, doesn't have any rectal symptoms. This way, that way, small symptoms, small other health issues, homeopathy is able to help him. Otherwise, this is one more case where I feel, yes, homeopathy can do. I don't know whether if they had come before surgery, how much we had helped. So only through, cases, we learn some of the things. So this is an indirect case where we have helped through homeopathy. And third case is of about uterine malignancy. There was, pre-malignant condition for 24 years old female. So that patient had 2-3 fibroids also. And they said, when they did DNC and checked everything, they said, this is pre-malignant. You better remove your uterus. Hysterectomy needs to be done because otherwise this turned into complete malignancy. But patient, she was unmarried. She had a lot of, looking forward in life. So she got her fibroid removed and came back to me. Then I started treatment for not recurrence of whatever it is, precancerous or fibroid or whatever it is. In few years, she got married and she was blessed with a baby girl and never had fibroid also. Forget about cancerous, precancerous conditions. And same way, they also had a group when she went for a treatment. She told me there are some patients who underwent, hysterectomy just before marriage also, because that all turned into a malignant condition. So this way, indirect method, we can also help patients who are precancerous or they have a cancerous diathesis, what we have read before, or we have a very strong family history of cancer. Homeopathy has a very good scope here. Till now, any questions, Doctor? Doctor,
No,
any
ma'am.
questions here? Or is it clear?
Chat box is empty right now.
Yeah.
No one has asked any question right now.
No, but so can we continue?
Yes, ma'am. I'll let you know if there's any question in chat box.
Yeah. Thank you. So now we will be, discussing 3 cancer cases. All cases you take will not work. I think you all agree with this. There are some, beautiful cases where we have helped. Some, without of our less knowledge. I don't say because of homeopathic treatment. So there is a one case which I will be discussing where I didn't know how to, proceed. And I didn't had some guide where I could, learn through. Now we have a lot of people who guide us how to treat certain cases. In the beginning, you take all the cases because you want to help people. So there are 3 cases which we will be discussing now. There are some cases, they don't come directly to you. They come through some, some opportunity you get to treat. This case I usually call, in Organon we read maintaining costs, how to remove maintaining costs. So this case, she was my regular patient. She took she told me, doctor, I want appointment for my aunt who is suffering from severe backache and leg pain. And she also said, please do something for her anger and irritability. She's really, making things very difficult for all of us. And my grandmother is having cancer, and my spinster aunt, who she is referring, has made her life horrible. She keeps scolding her. Always she is angry. My grandmother doesn't know what to do with this aunt. Please give her all, not only for her leg pain. And they all know that homeopathy helps as a whole. So do for her anger also. Said, okay, you send. I'll speak to her. This lady, Mrs. Yes, aged 59 years, came to me with all symptoms of lumbar spondylitis. She was very shabby and with lot of restlessness. Even in the waiting room, she was making, going this way, that way. And when I asked her, what is the cause of your pain? That is my usual question. I ask patients after asking all the modalities and whatever I have to ask, and I'll give them an opportunity. I'll ask them to tell me what must be the reason for your problem. She said, my mother is suffering from cancer of right kidney. She's bleeding and dribbling urine. Whenever she walks, there is a blood stain and urine all over the place. I am tired cleaning, doctor. I ask her to sit in one place, but these old ladies, she doesn't want to sit in one place. I am getting irritated and I scream lot at her. See, I did not tell her that I have I heard you have some anger issues or anything. She herself, started speaking about this. I am getting irritated and I scream at her. I know she is not well, but I am also old. 59 years, I understand. And my mother is 89-year-old. And nothing, see, we have gone to all the doctors. Everybody said nothing much can be done for her cancer. Whatever age she leaves, you just leave it. Don't do anything. But what to do for this, doctor? It is really troubling her. Can you do something for this bleeding and urine problem? If that is better, I think, doctor, I will be better. So now I have two patients to help. One is this right-sided sciatic patient, and another is now I have to do something so that this maintaining cause I remove and help that other, old lady also. So I didn't had much experience in cancer cases and all. वो सब हमारा not in our, we I think most of us have our own boundaries, which we have to now, grow beyond those boundaries. We should not think we cannot treat these cases, that cases. If you know homeopathy well, if you know the philosophy, organ and well, I think we should be able to take up any cases. So I thought, okay, what is her problem? Again, she told me, she showed her mother's report. I think her niece must have told her, you take reports, you talk to Dr. Jyothi, we will see. It was written malignancy of right kidney and there was no metastasis. So as I said, I didn't know much about cancer cases, but I somehow wanted to help her. So there is always one beautiful thing in our homeopathy. We have repertories. So I just opened repertory and saw MAC repertory. Kidneys cancer, there is a set of medicine. And kidney cancer, right side, there is only one medicine. That is Crotalus horridus. So you all know how good it is in a bleeding condition. Very frankly, I didn't know much about Crotalus horridus in cancer of the kidney cases. I believed, repertory so much. I thought, why not? Because I myself didn't know much about that. But our literature says there is a wonderful medicines for cancer. And that too for right kidney, you have only one medicine. I have a fascination for single remedy rubrics. So I thought, okay, I believed repertory and gave her Fatak. I cross-checked with Fatak. Hemorrhages are slow oozing of dark, thin blood, not clots, from all the orifices. Hematuria with cancer of bladder or prostate. Of course, it was not written that it is a kidney, but still, it is used in cancer of bladder or prostate. As I said before, almost all the literature we have mentioning of cancer in, many drugs. Only we have to open eyes and integrate in our system and start prescribing drugs, remedies in cancer cases. So what I did was, I gave her Crotalus horridus 200 BD for 1 week. I didn't have 30, so I gave 200. To my surprise, after 1 week, patient came. She was neatly dressed and she was smiling. She was not that restlessness or something. She told me her mother's bleeding stopped and urine dribbling also stopped in 2 days. After 6 months, there was a metastasis in lung with pleurisy. See, again here, because of her age and because of lack of my knowledge, I said, okay, if she is better, we will forget it. I am not doing anything. I have not given her any carcinosin or any other, constitutional medicine or anything, because patients, relatives weren't very keen on helping, taking medicines for her mother. They said, oncologist has told us, just leave it. Nothing much can be. And I also felt, okay, she is all right. But after 6 months, there was a metastasis in lung with pleurisy. I used to give spongia. Then again, they came in crisis. She's finding it difficult to walk from here to kitchen, from the hall to the bedroom, give something. Spongia really helped her in breathlessness. And within 3 months, that old lady died. But this lady, I gave only few doses of Rustox, and she felt really better. And that made me, I started taking some cancer cases wherein, only palliative. Because these people must have told 10 more people how it helped her mother, that we, without hospitalization, without much doing anything, we could stop bleeding, we could help her in breathlessness. So, like, lot of people came to me with a palliation. So that homeopathic acute remedies really works wonderful in managing acutes, any acutes. Forget about cancer cases. So shall we go to second case? Okay. We will go to second case where, I failed in this case. I would like to, discuss my failed cases also. All cases, as I said, doesn't give, very big results. This again is a one case where I didn't know how to proceed. This is a big challenge in homeopathic there is a literature, but we don't know how to integrate all those literature and practice. This is a different case. Von Hippel-Lindau syndrome. Female, 18 years old. Mother is housewife and father work as a manager in Muktidam, where all these after death rituals are done. So she has one younger sister. Weight of the patient is 69 kgs. This patient's mother was my patient who was better for uterine fibroids. Mother gave the history. My daughter is very obstinate. She gets angry very easily. Throws TV remote and my mobile. She quarrels only with me. If I don't talk with her for a few hours, she starts weeping. Her main complaint about me is I don't take her out anywhere. She is always sad or angry. The places which she wants to go is usually malls and multiplex, where I can't take her often as I can't afford. They're not very, economically strong people. So I asked patient, tell me what is your problem. And the patient gave me history, which I have not written here. Patient was with her grandmother till she was, 10 years or 12 years old. She really missed her mother during stay with her grandparents. She said, why should my mother leave me in grandmother's house? I could have stayed with my parents only. So she had that big complaint about her parents. I feel always frustrated as I can't do things like my friends. I want to go to malls. I tell my mother we will not buy anything, but just see all clothes and shops, do window shopping. She doesn't agree for that also. She tells me just visiting mall will cost 1,000 rupees. Can't she afford that much also? I want to wear nice dresses. Always my mother says we don't have money. I am angry whenever I hear this. If nothing interesting happens, I will cry for hours. Why don't you ask your father? Was my question. For me, everything is my mother. If she wants, she can do, but she doesn't want to do. I don't feel like asking father. All these days, my mother did everything for me. Why can't she do this? If she says father will arrange money. What happens when your mother says no? I feel like hitting her. I want to throw things. I have hit my mother a couple of times. After anger, I will start crying. I don't like to talk to anyone. Why angry only on mother? Who else will do for me? She asked me to go with my friends, but why can't she take? Only she will know what I want, but she is not doing for me. Repeatedly, her, uh, complaint was only about her mother. Patient was not at all interested to speak further. She's very angry, very, irritated. She told her mother, if you are not understanding my emotional problems, leave it. Don't embrace me by telling every detail to doctor. She didn't tell me about fear and dreams. She was not cooperating, further for case taking. Mother was complaining that girl doesn't help her in household work. And this girl walked out of the chamber. She said, I'm not interested. I'm going. So I gave her Calcarea iode 200, BD 2 days, and placebo BD for 3 weeks. I was also thinking Silesia, as I give this often to girls and boys of this age, as they are very rebellious, they fight for everything. The indication for this Calcarea iode was male feeling in Calcarea is that he may be terribly disappointed, betrayed, hurt, or even starved by the person on whom he is dependent. Here, patient feels only her mother can fulfill her wishes, nobody else. If not mother, who else was her biggest question. There is the dependency and need for security of Calcarea. But at the same time, there is the need to be very hard and strong and prepared for betrayal. Anger in adolescent girl was my basis for Calcarea iode prescription. After your consultation, in the follow-up during follow-up, patient told, I am not fighting with her, but she is sad and I am very helpless about that. I asked my husband to speak to her. My daughter is not talking to her father much. I repeated Calcarea iode twice for 2 days. Asked for HP and thyroid profile test, which never came because always mother said we can't afford all these things. But just before all this treatment, they went for, patient reported some uneasiness. So they went for this CT scan of the abdomen. So the diagnosis was von Hippel-Lindau syndrome. What it is, when I started Googling, I found out that this is an inherited disorder characterized by formation of tumors and fluid-filled sacs, like cysts, in many different parts of the body. Tumors may be either non-cancerous or cancerous and most frequently appear during young adulthood. However, the signs and symptoms of von Hippel-Lindau syndrome can occur throughout the life. This was a report mother showed me after a few months of the constitutional treatment. She told me, doctor, I didn't tell you my daughter has this, but doctor has told you can go to any oncologist or wait, we will see. This is seen in a lot of young children. Don't worry. Told her, you could have told me about this because this will be helpful in treating her. So then I started, finding her mother's report, whichever I had. She's also my patient since 10 years. Mother had uterine fibroid and treated by me successfully 5 years back. I had given her lapis alba and a few doses of medorinum in between. And after few months of treatment, 100% fibroid disappeared. So now she visits whenever she has cold cough. Her daughters, she has 2 daughters, have any problem. So I started, finding out, as I told you in the beginning, through when we treat, different cases, we also learn a lot of, new things. So I started reading Lapis Alba. I wanted to see whether this same, my mother Lapis Alba has helped. Why not this? We will see what is written about Lapis Alba. Phatak says glandular swellings where no glands are usually found. Boric says glands have a certain elasticity and pliability about them rather than the stony hardness of calcarea floor and cystus. So I did further research to know how lapis alba, you don't find many articles in So I got one very good article in Links in Vital Quest. What it says is lapis alba is a white stone and triturated by Gruag, who found it suspended in the mineral springs of Chastin, Germany. The lapis alba is a very light and soft, which encases rock, lapis lazuli in nature, acting as a protector of this gemstone. Lapis alba is composed of calcium, silicia, and fluorine. We have read a lot about physical characteristic of lapis alba, but mentally how it is, what mental symptoms, we were not aware. So I got this information. Study was done between 3 drugs: Calcarea silicata, Calcarea fluor, and silicia, using similarity and polarity method. Some of the foreign people do wonderful job. They take one drug and see how the central essence of particular drug we can find out. In that, when we're studying central essence of lapis alba, they studied these 3 drugs and found out there are elastic pull in 2 directions. The central theme may be essentially this conflict between totally dependent and duty-bound state, both financially and socially. And this desire to break away from this bond that perceives an incompatible by immoral behavior and portraying indifference to loved ones. In our case, she was so indifferent to her mother, fighting, irritating, getting angry, hitting her mother. So I gave her lapis alba 30, daily 1 dose for 1 month. So in the next follow-up, mother said, my daughter is not sad and she is not happy, not weeping. She is very happy. She is helping me in household chores. More importantly, she is not getting angry. So I repeated lapis alba 200 this time, 2 times 2 days. I was asking her to go for MRI of abdomen because I wanted to see how this, tumors are doing, how these cysts are doing. Some of these patients kept on, postponing, saying that it is very expensive, doctor. I don't know. My doctor is all right. No, forget it. I have come for that. I don't believe all those reports. That is all, as patient says, it is all bullshit. My daughter doesn't have, but still I was insisting that she should go for MRI and see. And I also, thought patient is better. So I didn't work further on that tumors and cyst. The girl was very cheerful after 6 months of treatment. Even during lockdown, her temper and her relationship with her mother was very cordial because she was not going out. But still, she was very happy. And mother was also happy. But still, somewhere it was, I wasn't very happy because I wanted to see how the tumors were doing. Her weight also decreased from 69 to 62 kgs. Everything was happy. As a homeopath, I was also very happy that patient was doing well. I have treated one more, precancerous case. But what happened? After 1 year, patient complained severe abdominal pain. No, man, our usual acute medicine help. Whatever I gave, she used to come back and say, no, doctor, it is not helping. I am really in pain. So somehow, when the crisis came, they could arrange some financial this and they took the ultrasound. Then doctor said, no, you have to go for MRI. I have a doubt. And unfortunately, that all turned into cancerous tumors. So constitutionally, for her behavior and for other things, I could help. But this, I think lapis alba didn't help 100%. Or I didn't know what mistake I did in between. I must have given some, I think, this which I was not aware. But patient started taking chemotherapy. Now also I am in touch with them. Chemotherapy is over. They say anytime it can come back. So be under, our supervision. Family now refuse to take homeo medicines. They say her doctor, I feel her, as a person, she has changed a lot. So for cancer, we want to continue allopathy treatment only. So somewhere I feel if I had, knowledge of treating cancer cases better, I could have helped this patient, 100, if not 100%, 80, 90%, I could have, but then this led me to read more about cancer cases. So this is the one of the reason, I came across Dr. Farooq Master's book, and it was really inspiring. Okay, I failed, not homeopathy. So through such cases, you can learn some more, you are ready for next thing. So this is a third case where I could really help because I started updating myself about this. This is not 100% cure case, but I could really help her during her all other treatment. So shall we continue?
Yes, ma'am.
Yeah, this is a last case about, this is all cancer case, which I could help patient, and I'm very proud to be a homeopath. Female aged 54 years, diagnosed with breast cancer. Oncologist suggested first chemotherapy, and you remove the affected this, and then radiotherapy. So somehow, as you all know, and even Dr. Sarkar sir and other doctors who are with cancer treatment, no, they say it is better you remove the part, you give some chemotherapy, because failures have taught us only homeopathy, you cannot, make some damage to the patient. So they came and without first, whenever they got diagnosed, they came running and said, doctor, we want to go with the whatever oncologist is telling, but we need some medicine for my, mother. I want to take homeopathy. I have read a lot about this. I want to give my mother chemotherapy. I want to remove if it is required, but give something so that she doesn't suffer too much. So whenever I get breast cancer, first book I read is Dr. Shruti Shah's book. I read that. Patient lost her history, Again, as Dr. Farooq Master told, every cancer patient has a story to tell us. So she told, I lost my daughter who was 12-year-old due to meningitis. Since then, patient was very sad and she was depressed for many years. But she has not taken too many depression medicine or anything. She herself was aware that because of my daughter's death, I am like this. It is karma, all those things she was telling. 1 year back, she noticed swelling in her breast. See the problem of our people. She didn't tell anybody that there is some, tumor-like thing. She didn't tell because it was her turn to take care of her mother. All other sisters had taken care of mother well. So she also wanted to do same. So other sisters should not think that I am trying to escape from responsibility. So I didn't tell anybody. Till my mother was in my home, nobody knew I had a small, growth in my breast. I didn't wanted to know my mother, her mother to know her illness, as mother was very old. I know how painful to see your own child suffering. So because she has seen her daughter suffering, so she didn't wanted her mother to suffer. So what all logic patient uses, I don't know. I gave her, I was so angry because I knew this family. Don't know what nonsense you did. You could have told somebody that I am finding some, swelling in my breast. I want to get it treated. She said, no, I wanted to take care of my mother. She may not come back. So all those stories. So when they went to they straight away went to oncologist because they knew. So son refused to give me, to share the reports in this because he had some insurance policy where he cannot. So I have taken copy paste of all the report. So impression says a symmetric irregular stromal densities in left retroareal region with skin thickening of left breast. Possibility of inflammatory type of malignant etiology to be considered. So BRAT was 4C. So they advised USG of breast. And the USD ultrasound said the left breast shows mixed fatty glandular echo pattern, ill-defined and irregular margined hypoechoic lesion noted in the upper outer quadrant measuring so much. So it was diagnosed as ill-defined hypoechoic lesion in the left upper outer quadrant with irregular margins, 12 to 2 o'clock position, extending to retroareolar region with dilated duct. BRAT category was 4C, suspicious lymph node in the left axilla with thickened cortex as described. So this is a CT scan they did. Then a patient of carcinoma left breast of staging, current PET study shows metabolically active, ill-defined lesion in the left breast with left axillary lymph nodes and skeletal lesion as described above, suggestive of carcinoma left breast with metastasis. So no other visceral metastasis. And here, what was worrying me more than left breast was there was a small metastasis. So I took a whole case. Again, I did not go for cancer treatment or, cancer drug. Whole case revealed because of her daughter death, her mother illness, and her, joint family problems. Everything led me to choose Drosera 200 once a week. And there was a strong history of tuberculosis in husband side. Husband had tuberculosis, son had tuberculosis. As I have learned from Dr. Shrutisha, my important, discussion will be about spouse history also. I ask, in detail, tell me what problem your husband side is having. So she gave me, there is a very strong history of tuberculosis in the husband side. So I gave her Drosera 200 once a week for 8 weeks. As they were suspecting metastasis, I gave her Ruta 6 daily twice for 2 months. This is all Sarkar sir's, guidelines when you suspect something. I did not give anything for chemotherapy or any other side effects. Only I had put this patient on this. So after follow-up, after treatment, they did one more MRI, which revealed the lesion in the spine is not metastasis, but it is tubercular infection. Whole course of chemotherapy was without any side effects. Oncologists were surprised. The son and mother came and told me they were not believing that I am taking some chemotherapy treatment. They were really shocked. How you don't have any symptoms? You are so event-free, treatment that was. So they were really surprised. Now patient, then she got her breast removed. Now she is under radiotherapy, but my treatment is, same. I am not giving her any other medicine. Now I have cut down Ruta 6X also because there is no metastasis. She is only on Drosera 200. So they did this, second MRI and CT said, finding consistent with infectious spondylodiscitis at D3 and D9 level with paravertebral and epidural abscesses. That is tubercular type of problem. But they were very, very happy that there is no metastasis and the patient is doing very well. And they also said that it is only because of homeopathic treatment. So far, any questions? Okay, what I conclude now, after, all my treatments of cases and this, the homeopathic approach to a case of cancer depends on sensitivity in which the patient presents to the physician, whether it is moderate or high or low. If it is moderate or high degree of sensitivity, constitutional remedy in medium or high potency is very useful. Even use of intercurrent is also very important here. Acute remedy should be given when patient is with cancerous phase. For the ill effects of chemotherapy and radiotherapy, depending on acute totality, remedy should be given. When you have low degree of sensitivity, here we don't see characteristic symptoms. The symptom that exist are the common symptoms of the disease. You know this. More the pathology, less the sensitivity. In such cases, the remedy is selected on the basis of the location and the pathology. Low potency is used, mother tincture to the 30. Mostly it help in palliation than in curing. In beginning of my practice, it was more of, I used to palliate patients because they were also not giving many, were not willing for. But now we get some cases where we can really help patient to come out of metastasis, come out of, any other side effects of the drug. So this ends my presentation.
Ma'am, we have a question in chat box.
Yeah, tell me, ma'am.
Can you please explain the indication for Drosera?
Drosera was, as I told you, was more of constitutional. See, every drug has 1 minute. Can I close this share? Yeah. Every drug has, many, you all are aware. Many drugs, almost all drug has, cancerous diathesis. But her constitution sensation level, PM level went into the Drosera. So I selected Drosera only because of her other totality of symptom, not because of her cancer. It is not, I saw this cancer and I gave this medicine case, but how we can help other way also was my intention to share this case.
Okay, ma'am. There are no more questions.
Okay. Thank you very much, Dr. Hafiza Malik of Vitalia and Dr. Yamini and
Thank you, ma'am. Thank you,
Yeah.
ma'am, for such a wonderful session and enlightening us with your knowledge. Next session will be there on Friday with our speaker, Dr. Shruti Shah, ma'am. Now I call Dr. Hafiza Malik, ma'am, to share a vote of thanks.
Don't miss Dr. Shruti Shah's session. Huh? Wonderful, speaker, wonderful. She's doing great job in this. Thank you.
Ma'am, we have a question in our chat box.
Yeah.
Can it happen that emotion suppression cause cancer? Dr. Seema Sultana is asking the question.
Yeah, that is what I was in the beginning, I was explaining, no? So for that, you better, I think, read Dr. Farooq Master's book. And you see many philosophy book, whatever homeopathic philosophy book, good old books explain how it affects, emotion affects the person. If it is not treated in appropriate time with appropriate medicine, it can lead to any pathology. Forget not only the cancer.
Okay, ma'am. Thank you.
Thank you.
Thank you, Dr. Jyothi ma'am, for an insightful session. We are very thankful that you accepted our invitation and you shared your such a valuable knowledge on the platform. And all the 3 cases are very valuable and very insightful. And the knowledge that you shared step by step in all your presentations are very useful to all the students also, and also on practitioners, and the books that you shared are very helpful and insightful, and also your deep knowledge also about the medicines that very few speakers are sharing about the failure cases, and it is very true that we should also share the failure cases so that other physicians should not repeat the same mistake, right? So it is very valuable insight that you shared today. Thank you, ma'am.
Thank you. Thank you very much. Thanks, Dr. Vaibhav also. Thank you, Dr. Vaibhav. Yeah. Thank you. See you next week. Yeah.
Yes.
See you all on next Friday. Thank you.
Yeah.
Thank you, participants. Thank you, ma'am.